Hi, welcome to Beyond the Paper Gown. I'm your host, Dr. Mitzi Krockover, and today we're talking about an often overlooked part of women's health, the vaginal microbiome. We'll get into some definitions in a little bit, but I am so eager to introduce you to my guest, Wendy Strgar. She is a trailblazer in this space, and she's the founder of Good Clean Love, Vaginal Biome Science, and Womankind Care. Welcome, Wendy.
Nice to be here. Thank you so much for taking a few minutes to learn about our work.
We'll talk a little bit about your background and how that led you to creating the company.
Yeah. So actually, I'm now the Chief Innovation Officer at Good Clean Love, and I was very, very fortunate to have to be able to hire a CEO who sort of succeeded me from Unilever, and she's brilliant. I also in 2021 founded a company called Vaginal Biome Science, and so that's our biotechnology sister company that kind of does all the patent work on our biomatch technology, and now we're super excited to be launching a new platform, hopefully by the end of this year, called Womankind Care, which is strictly a D2C vaginal health platform. So really dealing with the many diagnoses that are associated with vaginal dysbiosis. And I am totally devoted, if you would, to the health of the vagina. We find physicians like yourself who really want more for their patients, and those become good friends of mine and are also part of a really exciting network of physicians that we call the Institute for Vaginal Health. And so we do education for them there, and they distribute so far over 3 million samples to their patients.
How did you get into this under-researched, underexplored area?
So, partly I think necessity is always the mother of invention when you're actually doing something really useful and worthwhile. This is what we hear from many of the people who find solutions in our product line, is that they've been everywhere to try and find a solution. And that was true about me. So I'm in one of those community states, probably the second or the third, where I either never have the right bacteria or I'm always fighting to get back to the right bacteria. And we know 2/3 of women that's true about, right? So for all your listeners, I really want them to know that if they have chronic and recurrent conditions, they are in the majority of women. That's not like something is weird about them. Sadly, only 1/3 of women have a good, healthy microbiome all the time.
In the vagina.
Yeah. Mm-hmm.
So before we go forward, a couple of definitions. First of all, we'll be talking a lot about the vaginal microbiome, and that refers to a group of microorganisms, primarily bacteria, that live in the vagina. You just heard a reference to the community state, which basically describes the specific makeup of the biome based on which bacterial species is dominant within the vagina relative to the other species. Increasingly, we are learning that the vaginal microbiome and the community type affects the body in numerous ways and is connected to other biomes such as gut, skin, and even our oral cavity.
I think actually one thing that I hope happens over time is that we start to think about the microbiome as a single immune function in our body that starts at our eyes and sinuses, affects our mouth, our gut, and actually the exits are the vaginal and the rectal openings. But that tissue, that whole way along, is the same mucous membrane. It's all connected. And although there are different pH levels and different bacteria, healthy bacteria that protect each area, seriously, they're always talking to each other. So if you've got a lot of decay in your mouth, there's no way you can have a healthy gut microbiome. microbiome. And the women who are most compromised with the vaginal microbiome issues frequently have a lot of complexity in their gut microbiome, right? So we don't do a lot of science about that now, but the limited science that we do, there are studies that have shown that, chronic vaginal microbiome conditions are for sure associated with chronic conditions in the gut.
Strgar's personal journey included 4 kids and 4 vaginal deliveries, subsequent pelvic complications, and lots of yeast infections. But it was when her sex life was disrupted that she decided to find solutions for herself and others.
I started Good Clean Love because I was very fortunate, maybe because I'm a Scorpio, and I was always highly motivated by my sex life. As I was having all those children, that was the one thing that always worked with my husband, hallelujah. So the idea that I would give that up after I was having all these problems, I was like, this isn't going to last, So I was really driven to save my own sex life when I started this work, honestly. And so when we first started, I didn't know a lot about the microbiome or even toxic ingredients. I really learned on the job a lot of things and was very blessed. I met a biophysicist from Johns Hopkins relatively early in my career, and he taught me all the things that he had learned in this huge study that we were part of. I whenever I don't know what to do, I pray a lot, and I'm grateful that my prayers are answered by smarter people than myself.
In 2008, the NIH gave scientists $50 million to develop a protective gel to prevent sexually transmitted infections and HIV, because in spite of public awareness programs, infection rates were rising. The researchers made a surprising discovery. According to Strgar, most intimate products on the market are hyperosmolar, meaning they actually pull water out of vaginal cells through osmosis, like salt drawing moisture from food. This causes the protective top layer of vaginal tissue, or vaginal epithelium, to shed completely within just 4 hours. And when that protective barrier is gone, you become more susceptible to catching sexually transmitted infections and are more likely to transmit them. The vaginal epithelium is constantly balancing moisture inside and outside cells. Most washes, gels, and lubricants disrupt this balance, creating what's called a dysbiotic environment where pH rises and protection disappears. But Good Clean Love is not like most washes. Studies done by the HIV Alliance found that Good Clean Love is isoosmotic, meaning that it doesn't disrupt the natural cell balance. And it just so happened that the company had donated their product to the NIH study, not knowing this would make them the safest option tested. The takeaway is that the very products marketed for intimate health may actually be increasing infection risk by destroying the body's natural protective barriers. The study revealed that osmolality, how products interact with cellular water balance, is critical for vaginal health.
So you can see why they were trying to develop a gel that would be protective. But so what they didn't know was about hyperosmolar, right? They didn't know about osmolality until they did this extensive study, and we came out the safest gel because we were isoosmotic.
Interesting. So talk a little bit, let's level set everyone in case someone doesn't know what Good Clean Love is. What are your products for that specific? And then if you want to talk, we'll talk a little bit about the other 2 companies in a bit, but let's talk about that.
So Good Clean Love started, like I said, because I was trying to save my own marriage, right? My own sex life. And so it started with oil-based products, which we still sell. And that was the first product I used that I thought, oh my God, like it was sort of magical for me because it was an essential oil product. And, essential oils work on your limbic brain through your olfactory. And by waking up that part of your brain, you're really just jump-starting that arousal mechanism in the brain. I didn't know that at the time either, but I was learning. And it really worked. And so then one of our very early customers said, you really need a water-based lubricant. And that's how we got into lubricants. And in fact, that's what most people know Good Clean Love for. We're the top-selling organic and better-for-you lubricant in market. We're in almost every store. And I would always sort of struggle, here I am on a soccer field watching my kid play soccer, but also talking about sexual health with other mothers. My son would say to me, "Mom, you're just my mom, okay? Don't talk about your business." And especially when they were in middle school, they would say that.
By that.
Later on, when they were in college, they thought it was very cool. And I would find that I wasn't the only one, right? Like every mother I knew was having these problems. And so that was a big wake-up call for me when I realized that I wasn't alone. And they weren't really interested in having sex. Now, that's a very complex question of why they weren't interested in it. But for many of the women, it was because they had vaginal pain all the time, not just with sex, right? Their vaginal health was always at issue. And so why would you be thinking about sex? You wouldn't, right? So that's when I pivoted and turned my attention towards what would it take to feel better. And I also was in perimenopause at the time by then, and then kind of moving into early menopause. And so those questions were really top of mind for me as well, right? So then we pivoted more towards vaginal wellness, and we got a bunch of patents about our biomatch technology, and then it was doctors really who would come to me and they would say, "Well, why is my patient getting better from using your wash?" And I would say, "Well, I think I can tell you why, but let's do a study and we can see." And so that's how we started doing biotechnology, honestly. It was the doctors in our network that wanted to understand why was this working.
So Good Clean Love uses what they call biomatch technology, which is a patented approach that works in 3 steps to restore and maintain vaginal health. Step 1 is don't disrupt. That's where being isoosmotic comes in. Step 2, lower the pH, because once you're not disrupting the natural environment, you actively reduce pH levels, and good bacteria need a low pH environment. Otherwise, women remain vulnerable to infections. And step 3 is feed the good bacteria by providing D-lactate in gels and washes, since some women can't produce D-lactate naturally. The result is that the system becomes self-sustaining. Healthy bacteria thrive in the low pH environment and continue producing the nutrients they need to stay strong.
And so by us providing it in the gel and the wash, we can feed the really healthy bacteria. And in the studies, what we see is that it works.
While Wendy Strgar's entrepreneurial journey began with Good Clean Love, where she initially developed all her foundational knowledge about women's health products, she quickly discovered the complex regulatory landscape surrounding intimate health products.
We're a pretty highly regulated company. We make medical devices, even though, ironically, we're not really allowed to treat anything besides easing penile insertion. Is the only use case the FDA allows a manufacturer like me for a use case. So we can't really legally address any other issue. And that makes everything that a woman experiences a disease state, which means that everything a woman experiences needs a prescription.
This regulatory challenge led her to establish the Institute for Vaginal Health, originally called the Sexual Health and Wellness Institute. Here, she collaborated directly with physicians to understand the real issues women were facing. The doctors themselves became her product development partners, approaching her with their specific needs.
And those doctors frequently were the ones that said, "Well, can you make a product like this? I have these cancer patients. I have nothing I can give them." Or, "Can you make a wash that does this?" Right? Like, it was the doctors who were asking for product ideas. And so then after that, it just seemed like that company was really about working with physicians. And that's how we opened Vaginal Biome Science, to hold the patents and do the research.
From this physician collaboration emerged Vaginal Biome Science, her third company, focused on holding patents and conducting research. Strgar explains the separation was strategic to establish scientific credibility separate from her consumer brand.
And I think it's easier for doctors to trust that I'm not just trying to do some kind of thing with my brand, that I really am earnestly doing science so that we can better understand. So that's how I ended up with this family of companies.
And then the third company, Womankind, how is that different than Good Clean Love?
Womankind Care came to me actually during COVID. And because I was talking to all these doctors, and it was just so clear women couldn't get the care they needed. And just in the ways that we sort of continuously sort of move in a single direction, healthcare is really moving to sort of more and more of an online thing. So that's how this idea came up, that we could provide vaginal care with these protocols that we've clinically tested, and this test that I developed over 4 years that a doctor would actually read, right? Like we talked to the doctors and they said, yeah, I would read that test.
Womankind Care represents her most ambitious project yet, combining testing, coaching, and potentially a nationwide network of physicians who can prescribe microbiome-friendly treatments. The venture addresses a critical gap she identified in existing prescription treatments. You anticipated one of my questions, and that is, especially women in transition going through perimenopause and menopause, you're now dealing with hormonal imbalances as well as perhaps that obviously lead into microbiome imbalances. And it sounds like you're addressing that through some of the kinds of things that you're doing with Womankind.
Yeah, and like I said, even at Good Clean Love, right? Because, it's interesting, the things that our hormones do, which are basically everything, right? Like it's only when you run out of hormones that you realize how great they were. Even if you didn't love to cycle, it's like suddenly, oh my God, cycling was so great. So it's pretty tumultuous what happens even in a 1 month cycle for a woman when you think about sort of that. And so, of course, your microbiome and the dryness you have, right, the way your mucus changes over that. But, when you're postpartum, it's almost like a mini menopause, right? Yeah. So we really go through these transition cycles many times in our life, right? And we just don't talk about them. And then at each one, it's possible that our microbiome can be really impacted in a way where it's just not functioning the way optimally. Especially, like I said, if you're in those groups where you never really have the right bacteria, or you're always striving to have the right bacteria, then those hormonal changes will hit you even harder. So basically, what's different about Womankind Care is that we can give women a lot more care. Right? It's like transforming vaginal health with care. So a lot of women that used to call at Good Clean Love back in the early days, and they would just want to tell me for an hour their whole story, right? Because it's traumatic. Women have been through so many traumas vaginally. I mean, I interview women on Riverside, and they're literally crying on the phone about the things. And when they tell me the things that have happened to them, it's just heartbreaking, honestly.
Can you give us an example?
Well, like one woman who maybe is going to come work in our customer service, because then they become really motivated after they get better. It's like, I want to help people about this, And she had chronic UTIs, one antibiotic after the next. Nobody actually ever analyzed what bacteria was there. Finally, she flies 2 states away to go to a doctor who gave her 3 antibiotics at once. And was so sick, again, never tested. What is the bacteria, right? And so then finally, she was so sick, she just threw up her hands, and then she went on Reddit, where actually a lot of people find us on Reddit, and then she got onto our products, and she turned her microbiome around. But she couldn't have sex with her husband for like 2 years. It was really, I mean, and whatever, then like women who go through cancer, and they get radiation. I mean, we have a post-cancer protocol. Nobody's talking to those women. They don't even get sent back to their doctors after they go through that, obliterated vaginas, which can't even be treated medically, is the number one outcome of radiation therapy. And so, when they get a protocol of care, that can be turned around. So we're working with a really amazing doctor at UCLA and doing some studies on that.
Our conversation shifted to the interconnectedness of vaginal health with overall wellness.
So, what I always say, and I used to think this a lot about sexual health, right, when I first started in sexual health, is that you can't be sexually well if you're not physically well. And conversely, you can't really be physically well if you're not also sexually well.
The statistics are staggering, revealing the enormous scope of the problem and the need to address it.
So 2 in 5, if it's not 3 in 5, visits to physicians for women's health are about vaginal infections of one kind or another. So that's $20 billion a year. But it costs $40 billion a year of non-productivity. So the ways in which your vaginal health affects how you can be a wife, a mother, an employee, right? Like a daughter, right? Like, or just your own woman. And I think a lot of women do not have people they can get answers from. So what I think is that, vaginal health is such a fundamental part of what it is to feel good, right? Like when you feel like yourself again vaginally, it is such an immense relief, right? Like, especially if you've gone for years and years, and we haven't even mentioned like endometriosis and PCOS. Now, those conditions affect 1 in 5, 1 in 10 women, right? They're not rare, And so what I find is that by rebalancing, bringing stability back to the vaginal microbiome, right? Like with the wash and then a vaginal gel and a vaginal probiotic, that's what we call the core 3. And then if you do that routinely, what you find is that you've got good bacteria living there, and you've got your pH where it needs to be so the bad bacteria can't live there, and then the symptoms dissipate. And suddenly you're not having all that bad odor that you're trying to get rid of, right? You're not having the abnormal discharges, right? Like you're just really doing a biomimicry thing of trying to emulate what does a healthy vaginal microbiome look and feel like. And that's what we can do with our BioMatch technology.
I have learned so much. Thank you. And thank you for all the work that you've done. Before we leave, what did I not ask you that you wanted to make sure that our audience knew?
I would love to invite people to come in, and if they are dealing with vaginal issues like this, they should buy a vaginal gel and the vaginal wash, the balanced wash, and the probiotic, and then they should use those and see if that makes a big difference for them. And also, then if they're going to have sex, they should use one of our BioNude or one of our other lubricants so that they don't, right? Like it's all about maintaining this low pH, healthy environment where good bacteria can thrive. And so, everything else you have, just throw it away and start again. And I'd love to hear from them if they feel better. We're trying to start this campaign about feel like yourself again, because so many women are afraid to even ask about their vaginal health, right? And it's life-changing. That's like what women write to me. They're like, when they're crying, they just say, this changed my life. And that's why I overwork.
Oh, that must be so affirming.
I mean, I think I have like a ancient healing witch thing, that I came in with, right? Like,
that's wonderful.
And I was, of course, working all over my kids on that for years and years. And I think they were all relieved when I turned my attention to more people. But there are functional ways to heal our body, and antibiotics when you are really sick. There's really a lot of good times for antibiotics that save people's lives every day. But at a time when we know that antibiotic resistance is as big a threat as climate change, right? Then why do we not adjust the way we work with women about antibiotics and give them other tools, or at least in conjunction with antibiotics, other tools so that they won't get recurrences, right? Like there's just easy, common sense things that we are trying to bring into medicine, and we'll see if I live long enough to do it.
I think you've already had a good start, but let me just make a point before we sign off. Say someone's listening to this and they want to share with their doctors or healthcare provider, other healthcare provider, how would you suggest they approach that, and what resources would you suggest they point those healthcare providers to?
So we actually have this massive physician support network that we do a lot of education. We just wrote an article about the piece on men with BV, I think we're really at the forefront of vaginal microbiome work. And so we provide free samples from Good Clean Love to any doctor who fills out a 2-second form, or I don't know, maybe it takes 3 minutes. And then they get these samples for free that they can give to their patients. And we also have new downloadables that they can explain the science to their patients, and they can learn it themselves. And so if they just say, hey, listen, I heard about this thing about Good Clean Love. They have this Institute for Vaginal Health. You can get free samples. I tried it. Oh my God, look, I can't believe this is better, or whatever they're going to say. Doctors we have like 400 doctors a month coming to sign up without doing anything.
Yeah. So there is a desire to learn.
It's happening.
Exactly.
It's happening, albeit slowly, and we're trying to figure out what can we do that's functional to help people learn this. And so now I'm going to do this podcast circuit and see if like just by explaining it, like people can learn it. Because education is sort of the and especially in the world we live in today, right? It's the most precious of all resources, and also the most resource intensive to provide. Sure. But certainly when women learn this about their own health, and they feel better, like then they become advocates themselves, right? They tell every other woman they know, their mother, their sister, right? Like, their best friends. And that's how it goes, right? And doctors telling other doctors, right? And I want my kids, my daughters, to have agency over their health, so this is my small contribution.
Wow, it's more than a small contribution. You are very inspiring, so thank you. And Thanks. I think, and I know because of individuals like yourself, especially women like yourself, we're not going to go back. And you've already pushed us forward. Thank you for making us a stop on your podcast tour. Yeah. And I'll look forward to keeping in touch. Thank you so much.
Great. Thank you. I really enjoyed it.
I'm sure this conversation with Wendy Strgar, founder of Good Clean Love, Vaginal Biome Science, and Womankind Care, was useful to you, and there was a lot of good information. To recap, here are some important points to consider. Number 1, the scope of the problem. Vaginal health issues represent 40 to 60% of women's healthcare visits, costing our healthcare system $20 billion annually and resulting in $40 billion in lost productivity. Yet this area remains undertreated, under-researched, and shrouded in shame. The vaginal microbiome is a dynamic ecosystem that changes throughout a woman's life, during menstrual cycles, pregnancy, postpartum, perimenopause, and menopause. Environmental factors, medications, especially antibiotics, and hormonal fluctuations can disrupt this delicate balance. And as we discussed, you can't separate vaginal health from overall wellness. Chronic vaginal issues affect sleep, concentration, relationships, work performance, and mental health. The interconnectedness means that addressing vaginal health often improves quality of life across multiple domains. And current medical approaches often focus on treating infections after they occur rather than maintaining optimal microbiome health. Many prescription treatments, ironically, can disrupt the very ecosystem they're meant to help. So here are some suggestions to help promote your own vaginal health. Consider vaginal health maintenance as part of your daily hygiene routine, similar to dental care. This means using pH-balanced products designed specifically for intimate areas, avoiding harsh soaps and douches that disrupt the natural balance. Every woman's microbiome is unique. Pay attention to changes in discharge, odor, or discomfort. What's normal for you may be different from others, but changes from your baseline warrant attention. Be especially vigilant during times of hormonal change, postpartum, perimenopause, or after starting or stopping hormonal contraception, or even during stress. These are times when your microbiome may need extra support. And remember, vaginal health is influenced by overall health. Stress management, adequate sleep, balanced nutrition, and avoiding unnecessary antibiotics all support a healthy microbiome. As Wendy Strgar reminds us, women's health advocacy often starts with advocating for ourselves. By understanding our bodies, asking informed questions, and demanding better care, we can drive the changes needed in how the medical community approaches vaginal health. The goal isn't just treating disease, it's really empowering women to maintain optimal health throughout our lives. Thank you for taking the time to be with us today. For more information, please visit our website at beyondthepapergown.com and sign up for our newsletter while you're there. And before you leave us today, I would really appreciate it if you could leave us a rating and, better yet, subscribe to our podcast. As always, take good care. Our episode was produced by Patrick Shabayati and me, and our associate producer is Kyla McMillian.